I want to thank the chair. I want to thank all of you for obviously what you're doing. This is very, very important to the country. I want to also thank two of my constituents, Brigadier General Peter Corey, who is Deputy Commander of U.S. Army in Africa, who was deployed to Liberia in September and is helping to lead the U.S. military effort to halt the spread of Ebola in Africa. And I know General Corey personally, and I really appreciate his leadership. And also our state deputy epidemiologist, Dr. Elizabeth Talbot, who is helping train humanitarian workers in Africa. And I want to thank everyone who is trying and working very hard to combat Ebola and the spread of this deadly disease. I wanted to follow up on the issue in Dartmouth-Hitchcock in New Hampshire has been designated as a location where if we were to receive an Ebola patient in New Hampshire would be our designated health facility. And they have raised issues with me about the personal protective equipment that Senator Coburn had asked about, and concerns about not having access to that protective equipment if they were to receive a patient now, and also to ensure that they train properly in preparation should they receive a patient. So I know that we've discussed some of the manufacturing challenges to some extent of having the availability of this equipment, but I wanted to delve into that a little bit further to understand if there are hospitals like the one in my state that aren't able to have this protective equipment, what are they supposed to do in the interim?
So I appreciate your question. I think it's a very good one, and it's one that we've heard about from other places. So let me outline a couple of things. First of all, as I think you know, when a hospital determines that it might want to be in a position to treat Ebola patients and the state health officer agrees, one of the first things that happens is that they receive a checklist of things to start getting ready for, and when they feel that they're ready for a visit, the CDC will send out a rapid Ebola response, rapid Ebola preparedness team to do an assessment with them. Mm-hmm. One of the things ultimately on that list that is required for them to be ready is to have a 7-day supply of personal protective equipment on hand. We've been working obviously with CDC, with the states, with the hospitals, and if a hospital would like us to, we're in a position to give the name of that institution to the manufacturers and distributors of PPE. So in fact, they can be on a priority list to get what it is that they need, both to get ready and in the event that they have a patient. As I indicated in my previous answer, the Strategic National Stockpile at the CDC has also bought personal protective equipment, and in the event that a hospital were to receive a patient, they would, if needed, send additional PPE to that hospital. One of the things that the manufacturers and distributors have told us, and we've been working quite a bit with them, is that for hospitals that want to train on equipment, that they will actually come out to a hospital with training equipment, not the stuff that's in a short supply, so that in fact the frontline health workers who would be in a position to need to use that equipment can practice and can drill and can be ready for that. They've also told us, interestingly, that it's their perspective that many hospitals, because they're frightened, have been double and triple ordering equipment from various distributors and manufacturers. And so one of the things that we've been doing is working with frontline health workers all over the country to be clear about, number one, there are options in what you can buy, and that's in the CDC guidance. And number two, get a little clearer about really who needs what and how much you need so that we can cut down on the fear and the panic and be sure equipment gets to those who need it.
I appreciate that, and I think there needs to be, perhaps better communication, because this is an issue where obviously I know that Dartmouth-Hitchcock, which is a great hospital in New Hampshire, hasn't, and obviously part of a research facility connected with Dartmouth College. But I think that the communication obviously probably needs to be increased on this issue so that there's a better understanding from the hospital's perspective. So I hope that will follow from this. And I wanted to just also follow up, Mr. Kurlikowski, in terms of what Senator Johnson had asked you about. And as I understand it, there have been other countries who have actually restricted travel in terms of the West African nations and what's being done there. Do you have a sense of what some of our, for example, European partners have done in that regard and what their thinking is?
Senator, the only country I know that has restricted travel has been Canada, and I'm actually a little bit unsure as to what they actually have decided. As you know, too, from any of those 4 countries, there are no direct flights into the United States. So everybody leaving those 4 countries goes to Morocco, to France, to Belgium, et cetera, and they all fly into those countries.
So Canada is the only country. So I would think we would want to follow up and understand. They're such a important ally and obviously our neighbor as to what their thinking was versus our difference in policy on that issue. I hope we will do that.
We will.
Appreciate that. I also wanted to ask about some of the agreements that are in place. If you're thinking about the intake at the airports where the enhanced screening is taking place, are there already established areas of quarantine if that's necessary in those airports?
All of those airports already have CDC personnel that have been there for many years. And at first, and I have to give a shout out to the United States Coast Guard, who actually stepped up with medical corpsmen before our contracts went into place with EMTs and other local healthcare people to do the temperature screening. So it's been a really good effort. And of course, the key has been the relationships that our port directors have with those airports, with the CDC and others who've all worked together.
So my time is going up, but I had a specific question as to whether there are actual agreements between those airports and also the 5 airports and the area hospitals. In other words, do we have direct memorandum of understanding so there's clarity if we do have to act?
Well, we have a detailed planning process so that for each of the 5 entry airports, we have hospitals on the ready that we've visited with our rapid Ebola preparedness teams that we've ensured are ready, and we have a mechanism to transport patients safely. So for all of those, we have procedures in place that would allow us to do that. We have had a handful of people with fever or other symptoms coming in. They've been safely transported. None of them have turned out to have Ebola on the way in, but that is something that we have made sure is in place to the greatest extent possible.
Thank you.